Coming up today, a picture of resilience. Chemotherapy and then a bone marrow transplant gives this woman another chance to follow her big dreams. Today, her art tells the story. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. When we go for a routine checkup, we don't expect our lives to change forever. But Kati Toivonen used her passions to keep her fighting through her toughest times.
Yeah, so this is my little tree house at the top of my house. It's my studio.
Kati Toivonen shows us her favorite place, her art studio, where she brings her passion to life.
And then so here's kind of a close-up.
Okay, yeah.
Yeah, so, and there's like a medicine. This is where I make my art, and then I print the pieces, and then I hang them up to look at them and move them around.
When she's not working on her art, you'll probably find Kati running.
I had just finished the Boston Marathon in April of 2022.
That is when Kati's life came to a sudden halt.
So I was driving at the time, pulled over, and I remember looking at this tree and thinking, wow, this is it.
Weeks prior, Kati went in for her routine checkup and blood work. Her doctor was concerned. Testing would prove this would be way more than routine. Her doctor called to tell her they think it might be cancer.
I don't even know what a blood cancer is, and this is going to be the end for me. So it was shocking, totally out of the blue.
She was referred to the University of Kansas Cancer Center. A biopsy confirmed it was acute myeloid leukemia, an aggressive type of blood cancer.
I thought it was some kind of bone cancer. I had no idea, like, how can blood have cancer?
Kati had induction and consolidated chemotherapy. Things were going well until they weren't. Kati was told that she would now need a bone marrow transplant. The search was on to find a donor.
I grew up in Finland, small country. I was like, I'm not going to find a match. My brother was a half match. My sisters were not a match. I'm like, how am I going to find a match? And amazingly, they found like 10 matches in the U.S.
Kati received her transplant. She spent weeks recovering on the floors of the cancer center and is now doing well.
So this is an image from the gate area. The project is at B52.
And since then, she's been experiencing, well, pretty much everything. She's back to running, finishing yet another marathon. And her art, it was selected to hang in the new Kansas City International Airport. Even treatment didn't keep her from making that happen. Here she is in the hospital, approving the final version. Oh, and she married her partner of 20 years.
So the good thing that came out of this is perspective and gratitude. You know, so I live every day now with an immense sense of gratitude that I made it through.
And we are so glad to be joined by Kati this morning, along with Dr. Anurag Singh, Deputy Director of the Blood and Marrow Transplant Program at the University of Kansas Cancer Center. We are also glad to have with us Transplant Coordinator Karen Smith. It's so great to have all three of you here together again.
Thank you.
How's everybody doing?
Doing great. How are you doing?
Good, good. Yeah. Well, Kati, let's go back to that day in July 2022. How were you just feeling physically before you got this big news?
I was feeling great. I was training for the Berlin Marathon, and you know, I was a little tired, but that's typical. You get fatigued when you do long runs and hard workouts. So yeah. I was finishing up a demanding assignment at UMKC, and I was going on research leave. I had travel plans. Life was looking great.
You were living a big life.
Yes.
Right. Just plowing right through, doing your thing. What did doctors tell you that day?
Okay, so I actually got the news through my chart. You know, testing results come through my chart. So I saw it. It said acute myeloid leukemia. I had no idea what it meant, and I immediately, instinctively jumped into the shower. I felt like I needed to wash off this news and be by myself and, and while I was in the shower, the doctor called, and I missed the call. So I didn't actually talk to a doctor until I was admitted to the hospital. And then the admission process was very long, and they there were a lot of information was coming, and all at once, and lots of questions they asked of us and so forth. So I knew it was very serious, and then the conclusion was that this was going to be highly disruptive. You know,
highly disruptive. That
yes.
is not what you need to hear.
Yeah, so I don't know. My husband thinks I came up with that, but I think Dr. Lin, who was the admitting physician, said that. But regardless, it was, it has been true.
Dr. Singh, explain what Kati's diagnosis was. What is AML? Just break it down in terms that we can understand. What's going on in the body?
So AML stands for acute myelogenous leukemia. It's a very aggressive cancer of blood and bone marrow. So, you know, bone marrow is the factory where all blood cells, red blood cells, white blood cells, platelets are made. And most of the bone marrow is inside the hip bone. And inside the bone marrow, there are these early cells called stem cells, which give rise to all different types of cells. Now, sometimes what happens is one of these early cells goes bad. And when it goes bad, then it develops into a cancer, and then it starts growing without any control, and it crowds out all the other good cells. So all the other normal blood counts, they go down. And acute myeloid leukemia it's a medical emergency. It's an aggressive cancer. It's not a cancer where you wait and watch. And so, because untreated, it can be fatal in a matter of weeks to months.
Kati, I love what you said, and you can't be the only one. You said, what is this? I didn't even know that blood could get cancer.
Right.
What were you thinking?
Yeah, I mean, I had heard of leukemia in children, but yeah, I just had no idea. Of course, I immediately went to the internet and started looking things up, and then I realized I don't want to look at this. I need to talk to my team and my doctors and trust them.
That's smart. Dr. Singh, Kati mentioned, you know, she was had finished a marathon. She was training for marathons when she got this diagnosis. So when an active person like Kati comes in to your office, they're certainly not expecting a diagnosis like this. What's your approach with a patient who's healthy and then hears news like this?
Sure. So first we stabilize, make sure that they're not having any you know, bleeding problems or any infections, anything like that. Then second step, we try to get the fingerprint of the leukemia. So we do a bone marrow biopsy, and we look at those cancer cells under microscope. And now these days we do a lot of cool genetic tests to look at the cancer to see how aggressive it is, how it is going to respond to certain types of treatment, and whether they will need a stem cell transplant or not. And then, you know, we start them on chemotherapy, which are drugs targeted to fight cancer.
Okay, because you handled her bone marrow transplant before she came to you. She was seeing Dr. Yacoub, who is her oncologist, because originally there was hope that she could avoid the bone marrow transplant, that she wouldn't have to meet with you. So can you explain that part, the induction chemotherapy, the consolidation chemotherapy? What are those, and what are the differences?
Yeah, so as I mentioned, once she was diagnosed, and then she was started on this very intensive combination chemotherapy called induction chemotherapy. The goal of induction chemotherapy is to get rid of as much cancer as we can see. Now, the thing about cancers is that just because you do not see does not mean they are not there. Okay, and so so she first got several weeks of this induction chemotherapy, and then she started this regimen of consolidation chemo, where she got multiple cycles to go after the cancer that we did not see. Now, our hope was that she would not need a transplant. Unfortunately, she still had some of the fingerprints of the leukemia even after completion of her consolidation chemotherapy, and her bone marrow was not looking healthy. And that is why we decided that we should proceed with a stem cell transplant.
So how was the chemo process for you? What was that?
Well, so the first few, I don't know, 3 or 4 or 5 months, wasn't too bad. Some nausea. Of course, I lost my hair. I think the worst of it was caffeine headaches. I didn't realize, the chemo changed my taste, and I didn't have the taste for coffee anymore. So then I developed this piercing headache. I didn't realize it was caffeine withdrawal. So that was maybe the worst.
You said caffeine
withdrawal? Yeah.
Interesting.
Yeah. So that's what was maybe the worst kind of side effect of the chemo.
Okay, interesting. Yeah. Okay, so you go through this, as Dr. Singh mentioned, and you have to go through. You have to start now, kind of processing the idea of this bone marrow transplant.
Yes.
What did you know about that?
Yeah, so I had, so when I was going through my induction and actually during the consolidation therapy, chemo, I was told, I was scheduled for a meeting with Dr. Singh to talk about the bone marrow transplant. And I said, well, I don't really want to do it because I'm not going to need it. Of course, little did I know, but so we met and I understood that there's some risks, serious risks, and potential lifelong symptoms of graft versus host disease. And so I was like, I'm glad I don't have to do that.
So, because you're just thinking,
I'm going to be done with this by Christmas, maybe January. I'm done.
So when did you meet Karen? When did she come into your world?
That first visit with Dr. Singh.
Yeah.
So tell me, because you're from, where are you from originally?
Finland.
Okay, so then you were concerned, there were thoughts about where you were going to find your donor.
Right. I really didn't, I didn't have a lot of hope. I was really afraid that I was not going to find a donor.
What was that first conversation like? Karen, jump in and kind of, when you're brought into this, you and Dr. Singh obviously work very closely together with patients. What is that initial conversation like?
So I actually knew about Kari way before she knew about me. So as soon as she was admitted to the hospital, then I got assigned to her and immediately had her HLA DNA typing drawn.
In the event that she might need a bone marrow transplant.
That process takes a little bit of time, so we do it immediately as soon as we think that it could be a possibility. Then we get the HLA typing drawn. I called you, I'm sure I did, and talked about, tell me about your kids, about your siblings, what kind of related donor options do you potentially have? So we get children, siblings, if they're healthy and not too old. We try to use donors as young as possible.
So you're doing all this behind the scenes while she's starting the chemo process, thinking that this may work, right? Yep. Maybe this may not be a road you have to go down, but because this is a process that takes a while, you're doing
do it immediately.
Doing the ahead of time.
As soon as we know that she's diagnosed, then we start that process.
Interesting. Okay, so Dr. Singh, bone marrow transplant, we know it sounds like quite a daunting process to endure for most people, but kind of explain though in just like the most plain language you can, break it down, like how does a bone marrow transplant work? And I think we actually have some video that we're going to show as you're explaining of collecting cells from a different donor. What are we seeing, and kind of explain how it works from the donor to the recipient?
Yes, so as Karen mentioned, first step in bone marrow transplant is to identify a donor. A donor is someone who shares tissue type, not necessarily blood type. So for majority of the patients, we are able to identify a donor, either a sibling or an unrelated donor or other family member. So once we are ready to start the process of transplant, first step is to receive this high-dose chemotherapy. Think of this as, you have a yard and which has weeds in it. So first you try to get rid of the weeds, okay, and then you plant new seeds. So similarly, first with the high doses of chemotherapy, we try to get rid of the cancer, and then we put the new stem cells in that bone marrow, allowing them to grow. And so, and then patients, they recover from the side effects of the chemo while the new stem cells find their way to the bone marrow. and then they start building all the new red blood cells and white blood cells and platelets. And since these cells also make our immune system, they give rise to this new immune system. Now, one of the other things about transplant, which is more than just chemotherapy, is that the new immune system also fights the cancer. So there is that added bonus associated with transplant.
Gotcha. Okay, so once the bone marrow, so you get the bone marrow, how does the patient, how do they get it? So, and I think we have some video of that as well.
Yes, so
there it is, in a cooler,
yeah,
on its way.
Yes, so bone from the donor stem cells are collected either directly from the hip bone marrow, or these days, majority of the time, we collect them from blood. And then they are brought to the patient, and then they are infused just like a blood transfusion. There's no surgery involved for the patient. It is just like a blood transfusion.
Karen, who makes the best ideal donor for someone? I mean, we start with family, but what family members do you go to first?
So siblings, full siblings, have a 25% chance of being a full match to their sibling, and then a 50% chance of being a half match and 25% of being total mismatch. So Kari had a half match and then mismatches. So the next best is the International Donor Registry from NMDP. There's over 40 million people that just voluntarily get onto this registry. So once I had Kari's typing back, then I entered all of her information into the NMDP database, and then it does some special work and then pops out and tells me what kind of donors we have available for her and what matches there are.
It doesn't matter what part of the world you were born in, and because I think that was something you were. You're from a far. In your mind, you were like, I'm from. You're not from outer space, Kari. You were just on the other side of the world, and your donor was right up the road, kind of, from where you are.
Yes, yeah. My donor is from actually Omaha, Nebraska.
Yeah.
Yeah.
So you got those cells sent right on down, and got you on your way.
Yeah.
What was it like knowing that somebody was able to donate to you and help save your life?
Oh yeah, it's incredible. I mean, the fact that we actually had a list of 3 to 5 really excellent candidates, and young men is I think under 30. I think is that the criteria?
Ideally, the younger the better.
The younger the better, yes.
The youngest do the best.
Yeah.
Do the best. Can you be too old to donate?
Yes.
Yes. So we look at many different criterias, and age is a criteria. It's not the only criteria. For example, for siblings, if they are in their 40s or 50s, but they are a full match, we still can use them as donor.
Kari, you dealt with some complications afterwards, some infections, your lungs?
Yeah, and the chemo, the preparation chemo, the chemo that they gave me before the transplant, that was rough. I mean, it was a lot harder than the first. I thought, okay, I can handle chemo. Like I didn't. It was totally different. It was I was very sick, very nauseous and lots of vomiting and so forth. But then, there were just all kinds of, I don't even remember all of it, but I had double vision at one point. Yeah. Well, you might remember better what I had, because I was kind of out of it some of that time.
Are those some typical outcomes after a transplant? Can those be some risks?
Yes, so obviously the chemotherapy is very intensive, and it totally wipes out the immune system. So first, of course, it causes, affects the lining of the gut, so it causes nausea, vomiting, diarrhea. But when the immune system is wiped out, you are at such higher risk for infection. So you can get all kinds of infection. And when you get infection, you get weak and you get deconditioned. And sometimes the problems, they snowball. And so unfortunately, Kati had a lot of these complications after transplant.
Karen, what do you tell people to expect after their transplant and how to take it easy?
I tell them that we don't sugarcoat things, and it will be terrible for about a week or so, and kind of tell them when those highest days will be that they'll feel the worst. And I tell them that we don't make a lot of promises. In this world, we live in a lot of gray, not a lot of black and white. But I promise them they will feel rough, and I promise that it will pass.
All right, so you shoot them straight. Shoot them straight on that one. So, Kati, we take falls here at the health system very seriously. You have a little story to share with us. We don't want our patients falling down. If we think that you can, we label you a fall risk. Share what happened in your case. What made you the fall risk here?
Yeah. So this was early on during my second long stay at the hospital. So this was right out or during the right after the transplant, and I was rushing to the bathroom, and I was, I had all kinds of. I was hooked up to an IV pole. I had a central line in my chest that went right kind of into my heart, and the IV pole is plugged into the wall because it needs electricity. So I was being kind of sloppy, and I just grabbed the cord, and I didn't put it away properly, and it fell on the floor. The IV pole was wheeling or rolling through the floor, and it just got stuck on the cord and was going straight down. And then I quickly realized my chest, the line in my chest, and I just had this vision of it like ripping it out of my chest. So I just went down with the whole system onto the floor. And so, I had some bruises and so forth, but I'm sitting on the floor because the medical team immediately comes in, and so I'm sitting there and saying, okay, so I did this like tactically. I went down on purpose, so that this wouldn't happen, because I knew that if I had fallen accidentally, I would get the dreaded yellow socks, which are a sign in the hospital that person wearing yellow socks should not be walking around on their own.
So you were trying to avoid the yellow socks.
I was negotiating, yes.
So you said that you did this tactic. Oh, I like your, okay.
Yeah, I was like, okay, so this doesn't really mean that I fell, because
Dr. Singh, what do you think of this? She was that's pretty sneaky. That's a little sneaky of her to do this.
Yeah, I mean, it makes sense. If I were her situation, I would.
How would you feel if you had to wear yellow socks? You wouldn't like it.
As someone who's been running marathon and probably was one of the fittest people before coming into this, and suddenly you're told that no, you can't even walk on your own.
Right, now you have to be tethered, and now you have to sit and wear yellow socks. So what is your advice?
Yeah, so my advice, okay, so when I sat on the floor and they told me you have to wear the yellow socks, I mean, it was really, I think, one of the worst moments of this whole treatment, because I knew that the little bit of freedom I had, the sense of independence, ability to walk, it was just taken away, and I knew it was going to be for the whole rest of the stay. So my advice would be for anyone is like, do anything in your power not to fall. So if you have to pee in your pants, and do it. Don't fall down. I should have just, taken my time. Yeah.
Take care of yourself.
Yeah.
Do the right thing. Yeah, but we talked about that a little bit, about how sometimes you have those low points.
Yeah.
We'll get to that, but be sure to ask your questions. Use your chat on YouTube and Facebook. You can email the Medical News Network. That information is on your screen. But you do. You have your low points. You also have some high points during this time as well. It's been kind of an exciting time, kind of watching you get back to all the things that you love, and I want to get to that because that's really exciting. You decided to do your art while you were in the hospital. You had it shipped, those big prints that are now hanging in the Kansas City International Airport. You had them shipped to your hospital room, which was so cool. All this happening during this time. How did this creativity kind of help you cope during this time?
Yeah, I mean, during that time, especially early on, it seemed to be all about treatments and the illness and all the logistics, and I mean, I had to rearrange my life completely. There's dealing with insurance and all this stuff, and so your identity shifts from being who you are to being a patient. And continuing doing my art allowed me to have that identity as an artist, as a human being, the person I was before. And I did it in two different ways. I created a photo journal, kind of a blog that you know, I took pictures and I wrote little stories every day. It allowed me to kind of have a sense of myself, and then also a way to share that with families and friends. And then I had a deadline.
Yeah.
Because the international airport was opening in March, and I had to submit the finished frame works to the airport, and I'm in the hospital, and I had to continue to work.
Tell us about the piece, seen now by hundreds of thousands inside the airport. Tell us the inspiration behind it.
Yeah, so it has two inspirations. One is the I Spy books, where they're sort of visual riddles, but also the security conveyor belt that surveys all the luggage that goes through. And so I took items that family might carry in their luggage, and then I photographed them in such a way that they're kind of obscured a little bit, so it's a little hard to recognize them. Just like when you look at the pictures of the security footage from the conveyor belt, everything looks, the colors are off, and they don't look perfectly recognizable. So I created sort of like a visual puzzle for passengers of all ages to try to identify familiar objects like toys and snacks. And
so fantastic. Congratulations on being chosen for that. I mean, what an honor, and well deserved. Let's talk about the two men in your life. Your husband, your son. It's about time you two tied the knot, but you made him wait 20 years. I think that's fair. But they were by your side this whole time.
Yes.
How did that? How has this just changed your relationship with these guys, and how important are they to you?
Well, I think one thing we all share now is an immense sense of gratitude. I mean, it was a shock, of course, to all of them. My son was 19 at the time, and I was really afraid I wasn't going to see him graduate, but there he is graduating. So, you know, I had sadness, and they had fear, and but we were able to talk through all of it. My now husband, Chris, was by my side the whole time. He was incredible. He attended every doctor meeting, whether in person or by phone. There were times when I couldn't hear anything, I couldn't speak, I couldn't make decisions for myself, and he was there, and he still is. He still comes to every follow-up meeting.
Yeah. So, I love it.
Yeah,
I love hearing those stories, and we know family through a cancer diagnosis is everything. You completed thank you, by the way. I don't know where I was, but I got a text message from you when you completed the Berlin Marathon, and I opened it on some like random time, and it was on my phone, and it was so nice to see. So thank you for that. And then Dr. Singh, you and Kati celebrated her recovery milestone in such a big way. Start us out and tell us all about it. And then tell me, you've got something that you've got to share. So tell us about how you guys celebrated. Tell us about these photos.
So this is our half marathon medal. So last year when Kati was recovering, now again with the complications we talked about, Kati had become so weak. There was time when she was walking with the help of a walker, and from that time, but she continued to work through this, and we continued to with her treatment, and finally, she was like, once I get better, I'm going to start running again. And I said, yeah, well, we can run a race together, and I forgot about it. And then Kati earlier this year, she was like, okay, are we running a race this fall? And like, okay, I better start doing something about it. And
have you done it? Have you ever done it before?
I have run half marathons, but again, not a regular runner. But then I was like, hey, I've been part of this journey when you were sick. I want to be part of the recovery as well. And so we ran the Kansas City half marathon together. It was a lot of fun, and it was a great experience.
I love that. Can we show those photos again really quick? And Karen, what did you think about this when he told you that he was doing this?
I didn't even realize it was happening, and I got a text message from him of the picture of them, and it was amazing. We kind of, our team uses this.
Look at these two with the smiles on their faces.
So cute.
I mean, how adorable. This is just, I love this.
Whenever we have our team meetings and we talk about patients and will they be ready to go to transplant, we say, how do they compare to a marathon runner? And this was the time we're like, we actually have a marathon runner here. So it's pretty amazing to see you get back to that, and you too. It's a great story.
And then you got your medals to show. I love it so much. Those are heavy. Yeah. Well deserved. I love that. Thank you for bringing those in. I want to get to a couple of community questions and this morning. Well, one question and one comment. April says, thank you for sharing your story. So glad that you are doing well. And then Jeremy says, are cancers all roughly the same? And the differences are more about where they are concentrated in the body? Or are cancers really distinct and different cancers are more likely to attack different parts of the body?
So cancer is not one disease. You know, there are so many different types of cancers. Even, for example, in acute myeloid leukemias, not all acute myeloid leukemia are same. So that is why, you know, you need to find a team which can really dig deep into the specific type and which has experience in, you know, many of these cancers are rare. So every cancer is different and needs different kind of treatment, and has different prognosis. So it's not just one disease.
Jean is asking, is this cancer hereditary in any way?
So some cancers are, for those who are diagnosed with acute myeloid leukemia, approximately 10 to 15% may have some hereditary mutations which increase the risk of cancers. So that is why we do look at every cancer and see, hey, is there a potential of this being hereditary? But majority of the cancer is not hereditary.
I want to get our takeaways today. Karen, what do you want people to really walk away from this particular story?
It just shows how much, whenever we do this process, we tell people that the transplant process will knock you down. And that's proof here with Kati, again, you know, marathon runner to walking with a walker, but you can build it back up. And I tell patients all the time, you have to stay strong. You have to, the things that you can control, there's a lot of things that we can't control. You can control your mental state and you can control your physical state some, you know, by continuing to work on things. And it's a lot of hard work, but we see a lot of good benefits from it.
Well, thanks for your work with our patients. We appreciate all that you do. Kati, what's the big takeaway from your story?
Well, first of all, I'm just incredibly grateful, and my family as well. We're grateful for the incredible care we received at KU Medical Center. Very personable, very, you know, supportive, and looking at the patient as a whole person and not just the disease, which I thought was really important for us. For anyone going through this, I would say you have to be patient, but you also have to go with confidence. Have confidence in your team and yourself, and take it as it comes. And there will be a day when you'll feel better, and you can go slowly get back to your life again.
Thank you so much for sharing your story and your art. I can't wait to go looking around the airport next time I'm there for your art. It's going to hang there forever, and just your inspiration. What is the next marathon you're running?
So I want to do the Tokyo Marathon. I didn't get into it this coming spring, so I'm hoping 2027 it'll be Tokyo Marathon, and that will be my number 6 in the World Marathon Major Series. So then I'll get a special, very big medal.
Okay.
For those.
Come back and show us.
Okay.
Okay.
I will.
All right. Well, no running for you because you got to be busy here taking care of patients. Okay. We'll get you out of that one. All right. Thank you so much for being with us. What's the big takeaway today, Doc?
So for patients who get diagnosed with cancer, especially aggressive cancers like acute myeloid leukemia, know that it is aggressive, but many of these cancers are treatable, potentially curable. We have made a lot of progress, and we know a lot more about these cancers than what we used to know before. You have to have a good team. So when we walk with you during this journey, sometimes run.
Yes.
And so you take one day at a time, but also keep an eye on the long term, and stay active, eat healthy, and and we will do everything to get you through this.
Thank you to all three of you for being here with us today. Thanks to our guests. Thanks to our viewers for being with us. Coming up tomorrow, a military injury leads to powerful seizures this man never realized he was even having. On the next All Things Brain Health, this Veterans Day, the treatment that allows one veteran, now a doctor, to live seizure-free.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.